All right, it's 3 minutes past the hour, so let's start our meetup webinar of the day. Good afternoon, everybody, and warm welcome to PHEMS Project's meetup series. My name is Pekka Kahri. I work in Helsinki University Hospital, and I am the coordinator of PHEMS, the EU-funded project around aiming to build a pediatric health data space. So this is the first meetup of our winter series. So we will have 3 sessions during this winter, every month, 3rd Tuesday afternoon at 3 o'clock Central European time. Today we're talking about the Federation network, quite technical presentation by Ross. In a month we will have the same topic, but from a clinical perspective. Andrew Taylor will be sharing how we're using the Federated network for benchmarking purposes. And then in March, the use case on rare diseases, hemophilia patients, colleagues from Erasmus Medical Center will share how they are building algorithms and using the PHEMS infrastructure to help optimize the treatment of hemophilia patients. A few words about our projects. So PHEMS started with an idea that we need to find a way to collaborate cross-border on patient data between pediatric hospitals, because the patient population that we treat across Europe in pediatric centers are typically very low in numbers. They are small patient groups, they are rare diseases, and in order to make scientific work to obtain statistical power, develop new therapies and improve patient outcomes, we need to collaborate with data. There's also limited sources for assessing the effectiveness of new therapies that might be very expensive applied to children. So how an assessment of new therapies in real world environments could be tapping into a larger pool of data than any of the single children's hospitals possess on their own. Also, if we want to develop advanced analytics or artificial intelligence solutions that benefit children, so we need to have a way to engage with innovation ecosystems, algorithm developers, be they academic or industry, and since these are data hungry applications, so we must have a way to tap into a wider network of data sources than any single hospital has. And then many countries, especially smaller countries like Finland, there might be only one children's hospital doing the most demanding care, and then the possibility to benchmark its activities to improve patient outcomes and quality, you have to go cross-border, and then cross-border data collaboration is really mandatory. In the current privacy and data security environment, sharing of patient-level sensitive data is super difficult, so we are aiming at the federated approach, which will be the topic of today's talk from a technical perspective. So we are a consortium of 14 partners, 6 hospitals, 5 companies, ECO Children's Hospitals Organization, a network of broader group of pediatric centers, and then academic institutions. We received a grant from the Horizon Europe program to work on the data sharing of pediatric centers in Europe, which we aim to make a permanent collaborative setup we call the pediatric health data space. Helsinki University Hospital Department of Children and Adolescents is the coordinator of this program, and we are more than 2/3 through with our grant expiring in the end of September this year. So we are sharing the slides here and should be seeing if you have difficulties in seeing the slides. So maybe you need to re-enter the meeting. Today's speaker is one of the key persons of our project. truly engaged technical mastermind, Ross, who's Senior Product Manager at Aridia. He's responsible for the metadata catalog and data federation project, and he contributes to our PHEMS initiative in a multitude of fronts. So technical, governance, and data processing types. And he's really leading the development of the PHEMS federated node, which is the key component in the pediatric health data space. And he will now share the story of federated networks and how we are approaching that. So Ross, the floor is yours.
Thank you, Pekka. I'm not sure I can live up to that introduction, but thank you very much. Yes, hello everyone. As Pekka said, my name's Ross. I work for a company called Aridia. We're based up in Scotland. I am a senior product manager there, and our role in PHEMS primarily has been development of something called the Federated node, which is an open source project. We have spoken about this in a previous webinar, which I may refer back to later on, but I'll talk about the Federated node. I will talk about our involvement in the project and how the network is evolving. So I will take control of the screen. Let's make sure that can everyone see that as I move the slide?
Yes, now we have the title slide, the PHEMS Federated Network.
Cool. So I've successfully taken control. Excellent, right, thank you. Yeah, so what will I talk about as part of our webinar today? So we'll do a recap of that previous webinar, just a couple of the salient points that are relevant to today. Then we'll talk about the PHEMS network, which we didn't have when we did the first webinar just over a year ago. We'll talk about the components of that, who the different participants within the network be, so who are the users, explain like functionally how it works, so like step through the process of running a task within the network, and then talk a bit about the testing that we've done, and then to finish we'll talk about what the next steps are, so where we are just now, and then what are the next steps between now and the end of the project. So yeah, to recap, so as I said, I was fortunate to deliver, I think, the second or third one of these with one of our colleagues in the consortium, Bruno, who's based at Erasmus. And in that webinar, we spoke in very general terms about data federation. We didn't really anchor it to what we were going to do in PHEMS. We introduced the federated node, and we talked about what federated networks were and what the use cases of the PHEMS consortium were, but we didn't really speak specifically about the PHEMS network. So before we start on that, I shall recap a couple of things that Bruno and I discussed in that previous presentation. So the first thing, I think, just to kind of orient everyone and make sure that we're speaking the same language, is explain the model that we are using to define data federation. So this is actually inherited from another project called ICODA, which was the International COVID Data Alliance, and they produced this, I think, quite handy model for defining data federation. It has 3 levels, as you can see. So we have level 0, which is no federation. So that would be, I'm a scientist or a researcher and I want access to your data. I request access to it, and when you grant that access, you just send me a full copy of the data. So obviously that may well be subject to data usage conditions or have to be held in a secure environment, but fundamentally the researcher gets access to a full copy of the data and they perform their analysis on it directly. So that's level 0, no federation. Level 1, which is kind of the first step of abstraction, I guess, is a little bit different. So what happens here is that, again, I'm the requester. I request access to the data. When that access is granted, rather than being provided with a full copy of the data, I am given the right to query one or more remote data stores and return records that match the things that match the characteristics I'm interested in. So perhaps you have a database that holds records of like 1,000 patients, and I'm only interested in those over 50, or only those that are male, or only those that have some particular condition. So I would write a query query your database and then return the record level results for those subjects that match my criteria. So while the recovery and sharing mechanism is a little bit different for the data, ultimately the user still ends up with record level data. There have been like Federation projects that I'm aware of that have done it based on this model. I know certainly in the UK, Dare UK funded a project, the name of which currently escapes me, but that was how they set it up. It was a one trusted research environment calling out to multiple different data sources and retrieving record level results. Now, what we're actually talking about in FEMS is the final level on our Federation definition, which is level 2. And this really is somewhat different to level 0 and level 1, particularly from the end user's perspective. So again, as the end user in this scenario, when I request access to data, what I'm actually requesting is access to send my analytical code to the data, have it run in the data owner's environment, and then what I get back is the aggregate results of that code. So I ask it, in the simplest cases, I ask it, to produce an average or something like that, and I just get that average back, right? And I think, it's obviously clear to everyone that that's a very different relationship between both the data owner and the end user, and the end user and the data and their analysis. But that is what FEMS is set up to do. I'm sure everyone is aware of the reasons driving the adoption of data federations. Obviously, we have things like GDPR. There are certainly parts of EHDS which refer to federated analytics, but I think more generally, it's just good practice, right? This is the very sensitive data, and if there are ways that people can perform their analysis on it without having direct access, then so much the better. That seems like a kind of everybody wins sort of situation. So that's how we define federation, both in Iridia, but to some degree within the FEMS project as well. The particular FEMS use cases for federated analytics. So in the project proposal, there are 3 use cases, but I'm from a technical perspective, I'm really only categorizing those as 2 separate things. So we have federated analytics and federated learning. So the first use case, federated analytics, within FEMS, excuse me, the first use case is to provide benchmarking data among the partners for pediatric cardiology. So essentially what we're allowing the partners to do when they form the network, they can easily compare the aggregate results of their cardiology procedures across the network. So there's 4 founding partners, all leading hospitals within their own countries. They will be able to compare their outcomes at an aggregate level across a variety of cardiology treatments and procedures. And I guess we'll talk a little bit about how that's enabled when we're looking at the network. Use cases in 2 and 3, which from a technical perspective are much the same thing. So these are about running machine learning models across the network, so effectively using the network as a way of pulling data for rare conditions. And in FEMS, we have 2 use cases that want to do this. So there is one to develop a predictive model for the emergence of haemophilia, and one to create a predictive model for the emergence of sepsis within patients. So those are 2 different clinical use cases, but from a technical perspective, they require the same things within the network. So that's our definition of federation. These are the use cases that were initially put into use in FEMS. So let's talk a little bit about the network. So I had hoped that when we got to this presentation, I would be able to say that all 4 partners were now onboarded and the network was fully functioning. We're not quite there yet. We probably will be this time next week. Just one of the partners is having a little bit of an issue with their internal deployment of some of the software, but we're very, very close. And as you'll see in a minute, we have proven the concept of the network. So technically it does work. It's just one final partner needs to connect. So what we have, assuming you can all see this, so FEMS uses GitHub as a central point in the network. I'll talk a little bit about how that works on the next slide. But the analytical code is submitted and managed within GitHub. The federated node, which we talked about before, is the software that we're developing for PHEMS as part of the project, which is deployed to the partner sites, and that's what allows them to run the analytical code and then return the results. And then finally, for the current iteration, we're using an Iridia workspace, but this will likely vary over time. But we have a workspace which is used to collate the results and present them within a dashboard when we're talking about use case 1. So looking at the components of the network in a little bit more detail, as I said, the PHDS Central GitHub is where the analytical code is submitted for review, and where if a PR is submitted and approved, then that code that initiates the job being run within the data controller's remote environment. It's not completely unheard of to do this. So the Open Safely project in the UK, which is another analytical project, uses GitHub in a similar way. So they use it also for the sort of review and management of their analytical code. So we're kind of taking from there. And the federated node, which is as I say, the deployed software which receives that code and runs it in the data owner's environment. One of the stipulations that came out of PHEMS was that the data controllers could not have inbound connections. I'll explain in a minute how this works, but we had to do a little bit of supplementary development which would allow the federated node to work in outbound mode effectively. So it listens out for code being submitted in GitHub and then pulls it down into the data controller's environment to be run. For those of you who have a more technical bent, the federated node itself, so the actual engine for running the tasks, is largely based on the Global Alliance for Genomic Health's task execution service, which is like essentially like a simple specification for running Dockerized code on remote data. Slightly modified because we run it in Kubernetes, which I don't believe the original specification was designed for. I think that covers that. So those are really right now, those two things are the core components of the network. We have a couple of more peripheral components at this point in time. They are peripheral for slightly different reasons, which I'll get into in a second. So the first peripheral component is the workspace. As I said, we're currently using an Iridia workspace to host the results and the dashboards that those results will be displayed in. But the long-term PHEMS strategy is that there could be any number of workspace providers. So there could be a variety of different access providers who would all plug their own interface into the network. So it sits at the edge of the network, and it is by design expected to be interchangeable. So that seems to me to be definitionally peripheral. The data permit app is a little bit different. So the data permit app is currently peripheral because it's not integrated, but this will likely be a central service of the PHEMS network in future. So the data permit app, which has been developed by one of the other partners, Tieto, will be used to track all of the permitted tasks within the network. It's where applications for new work will be submitted, and it will likely be managed and hosted to one degree or another by the central services, the same people who will be looking after the GitHub repo in the long run. But no decisions yet about exactly how that will be integrated with the central parts of the network have been taken. So currently it is a little bit peripheral, but it will move into the center in the long run. So those are the components. Who are the participants? So who are the key users of the network? Who are the people that are going to use it to derive value from the data, and who are the people that are going to manage it? So in the first instance, we have the data users. So these are the people that will be submitting analytical code for approval and then receiving the results of that. So Now, obviously, that could be two different sets of people, but they'll all be hosted within like the data control environment. So Gosh, Hoos, SJD all have their data teams who will be writing code and submitting that to the network to be run. But they also have the clinicians who will be the ones getting the benefit of the who'll be getting the benefit of the clinical benchmarking stats, for example, right? And then hopefully later on we'll be able to use the predictive models to determine whether a particular patient is likely or not to develop one of these conditions. So that's data users. We then have the PHDS governance entity. So as I just said, this is the organization which will have to look after the network central services. Right now, that is the central GitHub organization, but it will also include the data permit app, and I suppose in future may grow to encompass other things, but that GitHub project and the data permit app are the first two things that the governance entity will have to manage. They will also, and I'll touch on this later on, but they're obviously also going to have to take something of a management role within the network, but we'll talk about that at the end. The other two participants, so obviously the data controllers are really the key people in all of this. The data is the value of the network. And they're going to be responsible for, I suppose, deciding which use cases they want to take part in. They're going to have to harmonize their data to take part in the network, and they're going to have to manage the software that's deployed into their environment to run the analytical tasks. And then finally, we have the access providers. Yeah, so as I said previously, the intention is that there will be multiple organizations which can provide access to the edge of the network, so give you somewhere where you can, in particular, receive results. So how that approval process will work, who will decide who is a valid access provider, I believe, is yet to be determined. But for the current state of network testing, as I said, we're using an Iridia workspace. That's that. So this is how it works. This is a simplified version, just also because Hoos and Gosh were the ones that ran the initial test, so I suppose they get first dibs on that. So yeah, it's quite a excuse me, quite a simple process really. So this presupposes a lot of things have already happened. That data permits have been agreed and approved, that a GitHub project has been set up, that the partners have harmonized their data, and that they've agreed on what code is permitted to be run on that data for that particular use case, right? So there are a lot of administrative and managerial things that need to happen before you get to the point of hit and go on the network. But once you've got to that point, the way that it should work is that the analytical code is submitted to GitHub for review. That will then be merged into the main branch for that project via the PR process, like standard bit of GitHub. And we have deployed with the federated node Argo CD within the data controllers environment. It is deployed in listening mode, and it is listening to the GitHub branches of the projects that data controller has agreed to participate in. When a PR is merged on a branch that Argo is listening to, that is then pulled down into the data controller's environment, where it is passed to the task controller, which is the thing that allows the federated node to operate in outbound mode. The task controller then passes it to the federated node proper, which is the engine for running the task, as we discussed. That task is then run, and then depending on the partner's preference, the results are either pushed back to a specifically created review repo within GitHub where they can review and release the results, or it can be pushed directly back to a workspace which is hosting a dashboard to display the results. It's not on this slide just because it was getting a bit messy, but we do have a way of pulling the results from GitHub into the workspace. So even if the partners have divergent routes for returning the results to the dashboard, we do have a way of bringing them all together in one workspace. So that's how it functions. That's the order of the function. This is proven We have tested this initially 6 months ago. This is just to give you a little idea of what the dashboard looks like. This is a prototype version of the use case 1 dashboard. It is still missing several things, but it gives you an idea of the sort of thing that the users will be able to do with it. They'll be able to toggle the participants, they'll be able to toggle the types of conditions, and then that will give the user some sort of like tabular or visualization of what the data says. And that could more or less be kind of cookie cuttered now for all the different benchmarking use cases. That's where we are. As I said, like the sort of essential technical test, like proving all the parts could work together, was actually completed about 6 months ago. I can't remember exactly, but I want to say we did that like June or July of last year. We're currently going through a second round of testing with all 4 founding partners. So Gosh and Hoos are connected to the network as our SJD, and Erasmus hopefully will be able to resolve their deployment issues in the next week or so, and then we will have all 4 partners on the network able to run use case 1, which I think will be a very, very good thing. So yeah, just watch this space, but we should have the network up and running within the next week or 2. So what are we doing next? So obviously the crucial thing at the minute is getting everyone on board for use case 1. But once we've done that, there are a couple of different things that will then become our focus. These are already to some degree underway, but the focus really now is on getting all 4 founding partners up and running on use case 1 on the network. So the first of these additional tasks is working on the machine learning use cases. So we are developing a ML plugin for the Federated node, which will allow more complex tasks, right? So running an ML model is just a much more complicated thing than doing some relatively straightforward benchmarking analysis, which is largely just, you know, returning aggregates from a variety of fields. So we're developing a plugin that will allow the Federated node to run ML tasks. We've actually the POC has already been used to test the model that Erasmus are developing for the haemophilia use case, so we know that it can run on it. What we haven't done is tested that fully with it being initiated from the network and then running in one of the data controller's environments. We've just done our own internal test with Erasmus's help. So the big proof of this will be doing that first test, right? Can one of the partners initiate a machine learning task in one of the other partners' environments via the GitHub initiation method? So the objective is that we will do that test before the end of Q1 this year, with a view to reporting our results at the PHEMS consortium meeting in mid-March. So that work's ongoing just now. The development is ongoing, but the testing has to wait until we've got use case 1 solidified. So that's that. So this is actually non-technical, and I think actually probably for the scalability and sustainability of the network more important. So this is the audits and controls work that is also happening in conjunction, in which I'm also involved in. So everything we really talked about until now has been what in development is generally called the happy path, right? Which is where everything works, right? And I'm sure everyone's experience of IT is that everything does not always work. And when that's the case, you need lots of procedures and clearly defined responsibilities that allow people to know what to do when there's a fault or when something has happened, an error. And that's what the audits and controls piece is about. It's about defining responsibilities and defining obligations to other members of the network. To give you sort of concrete examples of what that means, like at a very trivial level, you have things like, well, who is allowed to give new users access to the network, right? Who makes that decision? So you have to have a procedure for that, right? And that's relative trivia. Much more important things would be, even in a network where you only have 4 members, if I'm a data user and I run a query across all 4, but I only get 3 sets of results, clearly there's a problem, like in one of the data controllers environment, but who do I report that to? And how do I know it will be resolved? Do I have any guarantees about how quickly or otherwise my issue will be escalated and resolved, right? And then at the kind of furthest end of audits and controls work, like the most sort of serious examples would be if some code, by whatever means, is run on the network which produces results which are disclosive of an individual's identity. What procedures do we have in place? Like, so if I report that I've noticed that some results have been released which contain PII, who do I report it to, and then how do they manage that? Because we're going to have to know where that data is, and everyone who has it is going to have to destroy it, right? And that's obviously a very serious breach. So you need to have equally serious understandings about who's responsible for that and how they're going to manage it before it happens, right? And that's really what the audit and controls piece is about. We will in the first instance try and like scope it to the initial size of the network. So I don't propose that we will have War and Peace like in the first sort of iteration of the PHDS, but I think we should have something that covers off all the most serious use cases or the most commonly required things like user onboarding. So that's where we are. That's the overview of the network and how it functions, what the components are, who the participants are. We're very close to having fully functioning use case 1, should do before the middle of February. And then, yeah, hopefully we can push on, particularly with the machine learning side of things. So thank you very much. And if you've got any questions, I am available now. If not, please feel free to reach out to me. Thank you.